permission to love ourselves, and to look after ourselves as well as everybody else. How do we keep having the joy that we've talked about and the innovation we've talked about in the context of our own complexities? And we've got 4 speakers who are going to give us some very brief outlines of some of the things they've done over the last couple of years, 4 very different approaches to to self-care. So we have got 4 speakers. So Mavis, you probably all read the bios, but Mavis is our community and independent person who has a focus on allyship and lots of work on sort of meditation, complementary therapies, and youth and communities. Philippa Cockman is a fellow GP who I've known for a long time and who I have watched in admiration run Doctor's Mess during the pandemic, which has been a fabulous resource for GPs. Sanketh and I belong to the same international kindness group. He's a foundation year 1 who has managed the impossible, which is getting primary care, secondary care students and all sorts of other people to talk about kindness and how we talk to one another. Louise, I think the word flourishing is probably top on her list. And she's a GP educator who I can now see starts off in Bristol, but is commuting up and down between here and London. And we do have an addition to our group, who's Anne Bowers, who's not on our list of speakers, but has done a huge amount of work in the community and was talking to me earlier on about all the stuff we've learned from vaccination. We've got about sort of 3 or 4 minutes for each of the speakers, and then we should have some time for questions at the end. Ramya, do you have anything to add to that? Have I left anything out?
No, I don't think so, Claire. I just wanted to welcome everybody and just say, please do put your comments, reflections in the chat. I'll try and collect them as we go through. But also, as Claire said, there should be ample time for conversation and discussion at the end.
And just thank you everybody so much for coming. So Louise, I don't know if you want to kick off just in case exciting things happen with your train times.
Brilliant. Well, thank you for welcoming me. So yeah, I'm a GP in Bristol and I've been working as an academic. So I'm a clinical reader up at Barts in the London been working there since 2011. I've been I guess I started with the complexity and messiness of practice, which was a real shock to me coming into general practice, having wanted to be an orthopedic surgeon originally. But then I became fascinated by it and how we might educate for it. And so part of that journey was, as an academic, bringing creative inquiry, and that is exploring our lived experiences through the arts into medical education. I've been doing that since about 2003. To help students think about practice and talk about those things that often don't get voiced in medical education. You know, what do you do if a patient cries, or how do you continue to witness suffering? Those sorts of things. How do you be present to patients? And latterly, I've sort of realized that as students explored the human dimension of medicine and the patient, their own lived experiences through that creative inquiry process. So as they made art and wrote poems and they shared in a safe small group space, they started to share something of themselves as well, and discovered flourishing, really, that actually sharing some and creating meaning together and sharing lived experiences as well as the challenges led to students feeling in these small groups like a community. So this is a student selected component I've run for like 15 years. And they would talk differently to each other and bring more of themselves to the space. So for the last few years, I've been exploring flourishing as well through creative inquiry, through various funding bids. And I'm now working one day a week across the whole of Queen Mary University of London as a flourishing fellow and trying to find out co-creatively what it means to flourish. But actually flourishing is not really articulated yet. It's being increasingly used, but there's not a clear sort of definition of what it is. So I'm sort of excited at a grassroots level to be thinking about it, and I have some thoughts. But part of all of this is about moving the conversation from resilience and toughing it out towards something more ecological, more about meaning making, more drawing on Aristotle's eudaimonia, which is around meaningful and purposeful engagement in practice, more seasonal. So if I just stop and ask you the question, and I pose this to students as well, what do you think when I say, are you resilient? And how is that different to if I ask you, are you flourishing? And just to pause on that for a minute and think about what emerges. So resilience has been the sort of key message across all of this COVID pandemic. It's all over medical education literature, is you need to be resilient, and how can we make students resilient? And that is that sort of toughing it out on your own. And students are still being given these resiliency questionnaires, and you go through and it's like, I can bounce back from absolutely anything because I'm so strong and brave and tough. But I often use my birch tree out in the garden there that I can see in the different seasons. And I think we can be flourishing with no leaves. We can be flourishing in full leaf, but it's more about, it allows us to think about the sun that we're receiving, the rain, the soil that we're growing on, the different kind of soils and the different traumatic and otherwise paths that we've come through. It allows us to think about the sort of connections between, nature in the garden, between each other. So it's more about something interconnected. And when students witness each other's challenges and the whole imposter syndrome, without having changed anything, run more, eat better, all of those stuff, they actually start to flourish and feel better, and it all feels normalized. So yes, I'm basically working on what flourishing looks like and how can we support flourishing. And there's some of the sort of themes I've mentioned is the seasonal, ecological, interconnected, around meaning making, about compassion and self-compassion. But what you don't see in most of the other flourishing literature that's out there or talk about flourishing is around the keeping it real and the shadow work. So the sharing of the challenges and how important that is to flourishing as well. I'll leave it there.
Thank you, Louise. And maybe if people put thoughts as they have them in the chat, but if you have something that you think is a really useful question to share, maybe a question at the end. Thank you. The first person's already done that. Out of my speakers, would somebody like to go next, or shall I nominate? Silence. Okay, I'll pick Sanket. Would you mind having a go?
So, hi everyone, and really happy to be here. It's great to meet everyone virtually. So many fantastic speakers, and I think so much wonderful learning that we're having from each other. So just a bit about me. So I've just started working as a foundation year 1 doctor in North London at Royal Free Hospital, and I became interested in kind of organisations and how organisations function following my elective with the Care Quality Commission. And I think really from my experience so far as an F1, I've really realised that kind of the day-to-day experience of the job is really dependent on the people we work with and how colleagues interact and treat each other. And I'm a big fan of the campaign Civility Saves Lives. I think our interactions day to day, they have such a big impact, and we can really make each other feel valued and improve the working environment. So together with Sue, who's also here on the call, we've been giving these lectures on kindness and on kind of the importance of kindness and how we interact with our colleagues to a range of people. So other F1s, registrars, consultants, and it's just really getting people to think kind of about the impact of our interactions. We all know that we work in a really overstretched system, but small things like taking the time and being kind to each other can really have such a big impact. And also, I think we're a really big fan of greatixing, so learning from excellence. So it's a brilliant way to build up the culture and make each other feel valued. So I'll just pass over to Sue, actually, if that's just for a minute of my time, just to introduce herself as well, because I very much see us as a duo act, and Sue has so much to offer.
Hi, thanks, Sanket. The thing that really impressed me about Sanket was that as an F1, he had so many brilliant ideas and was not afraid at all just to tell everybody like it is. And I think that our tour de force was the grand round, when he spoke to all the great and the good at the Royal Free about kindness and about the impact that seniors have on juniors' lives. I think we're going to carry on with this now. And in fact, one of the areas we're going to be talking is to the students before they start as foundation year 1. So again, sort of embedding this into the whole culture of how they work. So back to you, Sanket.
I think that's all really. So yeah.
Great,
Thank you.
Oh, thanks, Sanket.
Go Ramia, go Ramia.
So Louise has kindly shared her research work, because I think Camille and others have been asking about where we can read about Louise's work. There was also a question from Rinny about, she sort of equated flourishing with colour, and she's asked, how do we connect with systems that are often unkind and expect us to be resilient and tough? Louise, have you got an answer to that?
Well, I sort of put something in the chat, but you know, it's a really, really good question, and I see people being sort of crucified in the system, you know, and coming to me, and one of the big things is, how can we be kind and compassionate to our patients if we are being treated without compassion and love, both in the sort of medical education and in the work systems? And it is problematic, but I suppose even within really difficult and you know, hard nut systems, if we have people that we trust and we can share some of that darkness, we do feel stronger. If you know someone's on side and you can share that does, so that sort of shared vulnerability, obviously you can't share that everywhere when some people stick in the knife, but you've got to know where you can. And if you have a culture where we are encouraging people to share vulnerability and that it's safe to do so, I think that can make us all, you know, it can make us all stronger. And I guess maybe we can be part of, I often, for the last 15, 20 years, I've often thought that of medicine as this massive concrete structure. And if I can nurture a few flowers growing in this cement, you know, where there's sort of soil is starting to gather in the cracks. Along.
That brings us about a really beautiful image, Louise. I also going back to what Sue said, she loves the word flourish as opposed to the word resilience. I think it's to frame that sense of sort of growth, isn't it? Sanket, can I bring you in? I just want to ask you what your experience is of talking about the narrative of kindness across the system, and what that has felt like, and what sort of feedback you've had so far.
Yeah, it's been really interesting. So so for the very first talk that we did for F1s, you know, all of us have already had, so this was a few months into working, and we all had, unfortunately, negative experiences with registrars and seniors, and it's something that everyone kind of recognises the impact that has on you, and also it's, you know, people are able to relate that to patient care. It means that you're going to be less likely to seek help. You're going to be less likely to speak to your seniors. So it's been really well received. And then going to the registrars and consultants, it's something I think that we just don't talk about enough. And everyone's very receptive. Everyone's been very receptive to the lecture. And I think it's very easy, isn't it, when we're stressed and under pressure, just to snap or to be rude to someone. But it's you know, having that reminder about the impact that can have, and just, you know, being civil. I think people, I think it's raising that awareness has been a positive thing, but it has been really well received. Yeah. Thanks,
Sanket. There's a really interesting debate going on at the moment, because there's consideration as to whether kindness is going to be brought in as a core component into GMC's good medical practice. And I think that's sparking a lot of debate. So yeah, very pertinent. Claire, I'm going to hand back to you now.
I think conversations about speaking up and looking after one another and things, Mavis, I wonder if that's a useful link, and guessing some of the things you might be going to say.
Okay, thank you. I kind of wanted to, bring together some of the things that I heard already today, and there is some noise behind me in the workman, so bear that in mind. So I think his name was Abdi in the previous groups talked about lived experiences as strength and empowerment, and how important it is to see it not from a deficit, but actually as a strength. My interest is in self-care.
My interest is in kind of letting go, allowing things to happen, in, you know, manipulation of energy, how our thoughts form our experiences or contribute to our experiences, and about trusting ourselves to kind of get a sense of what is right for us. And when I thought about today, I am pretty creative. As you said, I'm a meditator, and I like to be out in nature and connected to nature and happiness. Immediately a poem came, so you're actually going to get a poem to explain my journey and the kind of the idea of trauma and recovery and regeneration. So it's called There I Go, and I'll just say the poem now. Born premature in 64, many ailments caused me strife. Doctors, hospitals, illness ruled my days, my nights, my life. Racism, an ugly word, I learned to laugh it off. Blair Peach, New Cross, and all the rest. My head down, my inner stayed soft. In my mid-20s, 2 children, the rage was all there to blow. Marching, disrupting, demanding my rights, the militant in me was now sown. I looked to meditation, I began to ground. Crystals, colours, centeredness, my inner strength I found. I sit in daily meditation and practice, everything is fine. I let go and surf the universe, my life in perfect time. I focus on my issues, like birds they fly away. I release all pain and unhappiness, my imagination comes to play. I create my new reality, I smile and just allow. Myself I bring to a balanced state, my love to me right now. An idea pops into my mind, a story to create, a state of giving to the world. I smile, I cannot wait. So up I rise, to work I go, myself now settled in. My day is set to beautiful, my aim is anything. And that's just a very quick journey from birth, you know, being a premature child and in the 60s, lots of illnesses, and how I gradually came to meditation as a way of kind of managing a lot of ill health. How the systems, the structures, you know, I was born in Hackney, raised in Tower Hamlets, live in Newham. So the systems and structures, how I got involved in the local grassroots politics in Newham, in Tower Hamlets, and how I kind of built my fortress, but a happy fortress, a safe fortress, an assertive fortress to actually make sense of the world. So I could stay balanced within the chaos. I could understand the chaos around me, but I could stay balanced and actually work from that balanced state. So I hope that kind of was an expression of my journey.
Wow, Mavis. I loved your idea of the safe fortress, because for people who've been here all morning, I think that really contrasts with Caitlin's description of the armor that she and others wear. It would be lovely at some point if we could have the text of that poem, because then it could get collected up with all the stuff at the end of this. Are there any immediate questions from that? I wonder then if we move off to Philippa, and then we'll have had all 4 speakers, and looking at what we've written in the questions and the text, then perhaps it's about, I think, sharing some of the stuff that all of this has made us think. So Philippa.
Thanks, Claire. And yes, thank you for the introduction earlier. My name is Philippa Cockman. I'm a GP by background in Tower Hamlets. I've been a GP for 25 years there. It's been great to hear the people that have gone before, and a wonderful poem, Mavis. Thank you for sharing that. My main role now is Deputy Medical Director in NHS England, London, with the main remit of looking after GP appraisal and revalidation across London. So I'm kind of looking back over the last couple of years, because in March 2020, lots of things happened for all of us. But my role was put on hold. And And looking back in retrospect, actually that gave lots of opportunities. So it was put on hold because everybody was prioritising the needs of the beginning of the pandemic. But it gave opportunities for me to work across boundaries and become part of many of the people that are involved with this, working with other people in lots of different sectors, learning more about coaching and mentoring. Actually just having a bit of time to think was really valuable at that time. But as Claire mentioned at the beginning, I also got involved with something called the Doctor's Mess. And this was a group of people that came together to set up an online Doctor's Mess. Those of you who've been junior doctors will kind of remember what a Doctor's Mess was, a scruffy room, but a place for people to come and connect. So this is an online version of that, a safe space, a confidential space for people to come and talk about whatever they wanted to talk about, connect with each other, share experiences of what was going on at the time, offload. But I thought I knew about sort of kindness and compassion before, but I learned so much from working with this group of people about what the importance of connecting and sharing, the importance people have mentioned about self-care, self-compassion. The facilitators at the Doctor's Mess were an amazing group of role models for kindness and compassion. So I learned a huge amount, and the value of, as many people have talked about, trust and safe spaces for people to actually really share experiences. Yeah, so I just wanted to come back to my role, which did restart, but also the opportunity it gave to relook at GP appraisal. So when appraisal restarted, it had changed quite a lot in emphasis. There was an opportunity to kind of stand back from it and say, what can we do even better? So the opportunities were really to accelerate changes that were already happening, and have much more focus on people's health and well-being, and have that as a kind of integral part of appraisal, that not if you didn't want to, but give everybody the opportunity to have a conversation about how they are and how their work is and how their whole life is really, and to value the professional conversation with a peer more than spending hours and hours of pre-preparation paperwork. And the feedback's been really positive, that people have found it energizing. Some people have even written about it being a cathartic experience. So some people like writing and actually wrote lots and lots about their experience of those of the 2 years we've just been through. So I just wanted to finish really with acknowledging the workforce pressures that everybody's under. That I've talked about GP appraisal, but it's only one part of the whole workforce needs to be kind, compassionate to itself. We all need to be better at self-caring and self-compassion to be able to regenerate ourselves and be the best, as somebody said earlier, the best versions of ourselves.
Thank you, Philippa. I think it's been absolutely fabulous watching a very large system actually be influenced by some people and allowed to become more human, to focus on the human aspects. And I think that point about it, that for all of us, when we're being assessed and appraised, any of us who have influence, to make sure all of us have that kindness and compassion in our appraisals. I think all of this sort of conversation about listening and the things we've learned, Anne messaged me and had some things she wanted to say from her experience. Anne, maybe there's something you could just give a line about what you do and how you've had that experience and what you want to share.
Sure. So thank you for having me. This is already quite an emotional thing to listen to. So if I get quite emotional, I might do one of those crying in the office things. And Mavis, I think we've been in rooms together. So thank you so much for the poem. So I work in the public health team in Newham. I'm here for my director of public health, who's in election mode. And over the last, so I joined the public health team in May of 2020 to set up something we ended up calling the COVID-19 Health Champions Program, which was a conversation between the council, the NHS, and community members in Newham through WhatsApp, truly revolutionary, and Zoom, revolutionary at the time, but not now. And about kindness. We, and Jason, my director of public health, and I have reflected on this, we didn't expect that program to release kindness. We expected it to be a communication strategy. We got things to community members, they gave them to their friends, they came back to us. But what happened was a creation of kindness between the people in the community who would never have met otherwise, and also between the community and us. And I remember having one of our Zoom calls, and somebody said to Jason, he's a director of public health in the middle of a pandemic, but he sits behind a wall, right? He's in an institution, he's in a statutory body. Someone saying to him, "Are you okay?" And him saying to me afterwards, "We never do that. We never have a conversation as statutory or people and our community asking each of us if we are okay." And one of my kind of biggest successes was when we wrote the 5 ways to living well with COVID. We put kindness as one of the, you get tested, you stay home, you get a vaccination, you look after your health, and you have kindness. So that's been a really powerful thing. The second thing was about listening. And again, we didn't expect so much collective listening to happen. We sort of wanted to give people information they wanted for their community. And we started to listen to what the community was saying in the ways that worked for them. So again, through WhatsApp and other kind of day-to-day tech. And that listening really in policy decision-making in public health, and is now something we're doing across all of our programs and hopefully across all of the council. And then I just wanted to talk about a little bit, reflect on the point about flourishing, which again, one could have approached I'm talking just about my experience in the pandemic. This is obviously much broader, but one could have approached it as right, we have to get through this, guys. We just have to be resilient. And if we don't fall over, that's the best we can hope for. And while there has been huge pain and huge sorrow and huge suffering in lots and lots and lots of different ways, there has also been, at least in the experiences of people in my team, and I'm purposely staying inside this conversation about systems and relationships, a flourishing of connection and a flourishing of learning about how, back to the points made around kindness and listening, change the nature of the work you do and the experience you have in work. So I know a lot of this is a kind of conversation inside the kind of medical's wrong word, but kind of clinical sector. But it really, really resonates with the experiences that I've had, that I know Jason had, that I know those of us who in the public health who got to be involved in that intersection between statutory system and all the mess that is and real community got to experience. And so I wanted to share those thoughts.
Thank you beautifully, and showed how that can be influential at a system level as well. And again, Philippa, I think you've done the same, how sort of kindness can impact at a system level. And I think the impact it's had on so many GPs go through the appraisal process is quite phenomenal. So thank you for all the work that you're all doing. There's a couple of points within the chat. So thanks really for the signpost to civility saves lives. And Camille, you've made a really, really good point here about focusing on what's well with us. I think there's always that emphasis, isn't there, on what's wrong and what do we need to do more of. But I think, really turning it around and having that assets-based approach, even within our professional lives, I think is a really good point there. I'm also going to just introduce this word cloud now. I think you've seen it throughout the day. Which I'm going to repost, hopefully. So can you all see that now on the screen? And the question is, what changes our world asking us to make to regenerate ourselves? So if everybody could just take a moment or two to have a look at the word cloud and put in what they feel, and then we'll come back and rejoin, and then hopefully have a look at the word cloud right at the end of the session. I'm hoping everyone's had a chance to have a look at the word cloud. If not, please do carry on, but I'm going to, at the same time, just open the floor up for questions, because there's been so much rich discussion already. If you'd like to come in with a question, just please put your hand up and I'll bring you in.
Hi, so my question is, we've talked a lot about the GP clinicians or the doctors clinicians. I'm a social prescriber link worker now, but my background's 20 years as a nurse. So I've kind of done it from the both sides. So I think there is this question about, if we're talking just about kindness, it's not necessarily just about the doctors' interactions. One of the reasons why I left was because of the tensions that was actually amongst ourselves as nurses. So is there anything that's being done as a kind of a co-production between the doctors and nurses? Because ultimately doctors can't do their job without the nurses, and the nurses can't really do it without the doctors. But what I find really funny is that my mom's 84, and I spoke to an 86-year-old woman yesterday who's one of the first black nurses in this country, and the first thing she said to me was, it doesn't cost to be kind. So I think it's quite interesting that we're all these years later down the line and we're actually asking to do something that really should have been there all along. So I think it's really interesting that the systems of the cogs have been going at such a pace that we're actually going back to the very basics of life, which is being kind. That's just a comment on the end, but yeah.
Yeah, thanks, Gay, for that observation. Philippa, you've got your hand up, so do you want to come in on that?
Yeah, thanks for making that point, Gay. It's important for the whole workforce, all of this. And just to say, the Doctors' Mess had a parallel nurses group that sprung up as well. I think it's in all spheres of the workforce that so that people don't feel isolated. They've got places to go, they've got safe spaces they can go and talk and share experiences. So yeah, the Doctors' Mess itself is kind of winding up, but there's lots been replicated in lots of different spheres all over the place. So it would be great to see it happening more and more.
Thank you. Did you also want to come in on that point? Oh, sorry, Sue, I can see you've got your hand up.
Hi, yes. I think that sometimes what we really lack, often what we really lack is time. And I think one of the things that prevents people from being kind unintentionally is because they just feel so pressurized the whole time. And actually just taking a moment, at the end of a ward round, just to sit down, even if it's just for 5 minutes when you're really, really, really rushed, and just checking in on everyone makes a massive difference. And I just also wanted to get back to that point about nurses. It's my experiences that sometimes nurses can be very tough on each other. And I think we need to all work together very well. And doctors can be tough on doctors, doctors can be tough on nurses, nurses can be tough on doctors. But just understanding everything and trying to be non-hierarchical as well is something that I think we really have to work on. I'm a secondary care person, and I know most of you are primary care, but probably secondary care is much more hierarchical than primary. So lots of things we're working on, but Sanketh and I are just rolling this out to everybody and everyone who wants to listen.
Great, thank you, Sue. Claire just said we've got some training hub leads within the group. So do any of you have any comments about how we support the whole team and make this sort of kindness movement more inclusive? That's our word cloud that seems to have just popped up onto the screen. So while we're having a look at that, please do come in if there is anybody who's got background in training hubs.
Hi, I'm Shula Kamilajyan from the NIFM Training Hub, and I also manage the Northeast London Training Hub. It's great to be part of this conversation, and I think, Louise, when we have the conversation this week about the exhibition and the artwork, I think that was one of definitely my highlights. This week, maybe this month, and in fact, maybe this year. So it actually kind of, created a lot of very positive energy for me. In terms of talking about training hubs and how we are supporting our staff, we have the kind of a lot of activity in terms of well-being hubs, for example, working very closely with our Keeping Well Now. We have started this year our integrated Schwartz rounds for Northeast London. We have support groups similar to Doctors Mess. We actually provided groups for our nursing colleagues. There is a lot that is actually happening within that space. A lot of information can be accessed from the Training Hub website, and if there's more that we can actually do, we would be very much willing to do that.
Thank you, Sil. Thanks also, Louise, for the comment that you put in the chat about learning from patients and the sort of opportunities that presents in terms of flourishing. Louise, I actually read your bio, and there was a line in there that really stood out to me, which I'd quite like to read out and get a response from you on. So it says, the arts can slow down our listening and extend engagement with the other, as well as allowing us to hear the songs we carry in our own hearts. I thought that was just such a beautiful line in your bio. So I was just going to ask you to come in and respond on that.
Yeah, so I mean, so this student selected component that I've run for like 15 years with small groups of self-selecting students is one area that I've been doing the creative inquiry. And as there's something about the language of the arts that doesn't nail you down to having to say things. So students can explore their lived experience, and then they can choose how much they share in the group. And sometimes they would write more in their reflective journals that I would read afterwards, and they didn't say the whole story, or sometimes they would really kind of share the whole story. So, and what would happen is little by little, students in the group get to know each other over, say, the 2 weeks and share a little bit more. And compared, I suppose, to the reflections that often medical students are asked to do, and they sort of just make sure they tick the boxes and put something a little bit sensitive in there, and they know that they're not going to reflect in a truly sort of open and vulnerable way often in these kind of tick box spaces. So just by getting into flow, as I think Janica was saying, or someone was saying, and creating those spaces where you've got the silence across the group and all the students are creating something. And some of the students would reflect, there's lots of reflections, like this was like a breath of fresh air, or I've got to know myself better over these last 2 weeks than I have in my whole 21 years, because I've been able to express my emotions and be able to express what I'm thinking without having to censor it all. And that's how we sort of hearing our own songs and our own, and making space to listen to others. So I try to cultivate this sort of using the vulnerable leadership idea. I try to cultivate a space. And then the arts do their work as well. So I think without the creative inquiry, we wouldn't travel as far, I don't think.
Thank you, Louise. Mavis, so you've got your hand up. Can I bring you in, please?
It's just following on from what somebody said earlier, is about kindness and just starting with yourself, really. Because as you said, when you look at the kind of clinician to patient, if you can't find kindness in yourself and for others in the workforce, how do you translate that to the patient? So really being kind to yourself, and that could be simply smiling. I know somebody who was having real difficulties at work, and I just said, and they expected her to blow, and she did, and I just said, go in for the week, just try it for the week, smile. No matter what happens, you smile and take a deep breath. And she found by the end of the week, people noticed and people were different. Not all straight away, but very subtle changes in the way they approached it and their expectation of what she gave back. And kindness is given a gift. You know, I say to my children, you know, give a gift out every day, and that could be a smile, a compliment, you know, a flower, anything, just to find something to give to somebody else every day, and that just kind of builds up, you know, the kind of change in yourself and then your environment that you want to see.
Mavis, I love that idea of it being a gift that we can just freely give. It's a really nice thought. Camille, can I bring you in, because you've raised an interesting point here about whether the active bystander principle should be extended to acts of kindness. Did you want to comment on that?
Thank you. I wasn't expecting to speak, but completely happy to join in. Yeah, I had an interesting experience yesterday where I saw a colleague having a comment made against her. I heard it quite clearly, and yeah, I kind of carried on with my day, and she looked like she carried on. And then in the evening, when I started reflecting on it, I thought, oh, maybe I should say something. And I contacted her, and she was so relieved that I'd contacted her about it. And I was like, I was very close to not contacting her about it, because she seemed okay after it. And it just made me think, like, you know, we talk about active bystander for other aspects like racism and stuff like that. And I was like, maybe we need to think about it. This wasn't bullying. It was a comment that was taken in a particular way. It was quite a harsh comment to be made publicly, but it had some validity to it as well. So I don't know, it was interesting. And I thought that was an example of, like, because I think, you know, on a basic level, like one of I think Gay already said that, you know, kindness is a really basic thing. Like, I feel a little bit silly, like, in a way it's stuff we know already, but then there's this level of stuff that sometimes is kind of a little bit, you could play it either way. And I wonder if there's a space for maybe practicing these scenarios or just talking about it. I just thought it was interesting. Thank you.
Thanks, Camille. Are there any other hands up or anyone else who would like to come in?
Yeah, can I just add on that? I think that's a really interesting point, Camille, because we know that these interactions or incivility, you know, it's not just the recipient that's affected, it's people that witness it too. So it's really interesting that you mentioned that, you know, wonder if a debrief would also be helpful for people like you who've witnessed that, and that's something that I think we need much more recognition for. Just being in this, and the great thing about Civility Saves Lives is they're compiling kind of all the research. You can see the stats about this, the impacts of incivility. So it affects the recipient, affects people who witness it, but also affects service users. You know, they have less enthusiasm for the organisation. So it's incorporating everyone affected, and I really thought that was a great.
There's also a really great book by Michael West on compassionate leadership, which I'm sure some of the group would be familiar with. And it talks about how there's been a real focus on the NHS in terms of efficiency, productivity, value, and almost at the expense of compassion and compassionate leadership. And actually, you know, there's a real argument, and it's an evidence-based argument actually, that if we focused on compassion, all the rest would follow. And so we're really just focusing in the wrong areas. So yeah, I am hopeful. I mean, you know, today has given me a lot of hope, definitely, that things are going to change, and at least kindness is on the horizon. Louise, I'm going to ask you, and actually to the whole panel, do you feel that we're now in a position where the doctors of tomorrow will look different, will be prepared differently for what they are likely to encounter in their professional lives? And I say this, you know, because I picked up on the point you said, Louise, about how you felt like you were wholly unprepared for what you were going to face in general practice, the complexity, the trauma that you were going to encounter. And do you feel like the seeds that we're sowing now are going to lead to a different and better future?
So, I mean, I think that definitely we're moving in the right direction, but there are lots of pressures in both directions. For example, the medical students of today have lots of pressures I didn't have in terms of finances, in terms of being ranked to within an inch of their life, you know, knowing what number you are, which breeds competitiveness and not collaboration. And so there's all sorts of problems that are, you know, an increasing technology and increasing busyness and increasing complexity, which is hard for our students and our junior docs. So I think there are forces going in those directions. And I think there's still a lot more to do in medical education. So I've actually had an artist draw a double-stranded DNA. And one of the strands, this is for clinical consultations, one of the strands, I believe, is the clinical work that we do. And that is quite well articulated, taught and examined. But I think the other strand is called the human dimension. And that is not articulated and taught properly yet. We don't even properly have the language. So yes, kindness, things like self-compassion, compassion for others, the therapeutic alliance, reflexivity, narrative humility. I'm sort of building a list around what I think, and maybe I feel like my life work before I retire, it'd be really nice to have a human dimension in there in the center of medical education, but who knows? That would be a collaborative project with people.
Great, thanks, Louise. You sound like you certainly got your work cut out for the rest of your career. Rini, can I bring you in as well? So you've made a point here about appreciative inquiry and how we can use that approach to amplify all the things that we are doing well. Would you be happy to come in and comment on that?
Sure. I was just thinking, you know, we have a sort of preponderance, don't we, to sort of a negativity bias, and thinking about, you know, I couldn't help but think about the sort of systems we work in and the things that don't work well. Especially when, you know, you're feeling a bit sort of up against it. And today has just reminded me about all the things, you know, as Louisa says, that, you know, reminded me about, you know, when I'm flourishing, the bits of me that are flourishing, you know, not every bit is, but, you know, there are lots of bits, and actually appreciating that. And today has just reminded me to stop and appreciate so many of the things that do go well in our systems, and, you know, thinking about the appraisals that have changed. And, you know, so I think that sort of, you know, really building on the things that are going well so that we can continue doing them is so important.
I think often we just don't have the time to reflect on the things that are going well. We're just encountering problems and firefighting. But I think it's this sort of time and this sort of space that allows us to appreciate actually things that are good, and also to share the space with individuals who are, you know, committed to the same principles as well going forward, which I think is, yeah, really positive and hopeful for the future. Great. Is there any sort of final comments that people want to make? Oh, Anne, please do come in.
Sorry, Rami, I was reflecting on your previous question, which sort of sits outside of my world, as it were. But I do think there's I wonder if there's a next stage question, which is about people involved in enabling communities to have good health. Now, there's a GP side to it and a clinical side to that. There's a public health side to it. There's a culture side. There's a whole range of different things where, and the reason I'm so kind of interested in statutory organizations is we hold so much money, frankly, and money is the power, is one of the most important kind of tools to do things. Not lots of money, but a little bit. But I think there is a question about thinking of ourselves as a family of resources supporting communities, including ourselves with our community hats on, to have good health, physical and mental, and whether that question you asked applies to those other roles in that system as well.
Yeah, I wholeheartedly agree. I think it has to go beyond. None of us are working in silos, are we? We're working for our communities and our population ultimately. So yeah, I just wanted to sort of end today really by saying a huge thank you to the panel. Thank you to Louise, Mavis, and Sanketh and Philippa for your contributions, and thank you to everybody who's joined the discussion today as well, for being really sort of engaging and keeping the conversation alive. And thank you for sort of championing kindness, compassion, and all the things that we know are so important in our professional lives, but also for our communities as well. So yeah, thank you. I think what is going to happen next is that we will be pulled back out into the main room, but if anybody wants to take a break, then feel free to do so. Oh, Claire, did you want to say anything as well before we end?
No, I think, so I suppose I'm wondering how we're all feeling, and I hope that for many of us that's good, and I guess then how do we seize that and do something with it? This is about our well-being. That's what this session was about, and I guess there's an awful lot of people out here who couldn't come today or didn't know about today or were too busy about today, and how do we take things forward? Thank you so much, everybody. I've learned so much, even if no one else has.
I'd definitely like to learn more about the flourishing. I mean, I've thought about kind of like not surviving but thriving, and now it's not resilience, it's flourishing. So I'm really looking forward to finding out more about that.
It's a lovely word. Thanks, Philippa. So I think we now go back to the main meeting by clicking on leave the room and then leave breakout room.